Olsen with IBM Watson Health, and I'm extremely passionate about the topic today. So I want to go ahead and start with my vision. So I have a vision about a care plan for every person, and maybe better said, maybe a health plan for every person as we look more broadly than just the chronic condition management. And my journey, it's funny, I was thinking about this morning, my journey actually started at Medicine X, or I guess this particular journey. I went to, a few years ago, I went to the IDEO session. We were sitting with patients and designing and going through a day of discovery, and it was a wonderful experience. And I went back and I said, you know, I've been working so closely with nurses and doctors and trying to build products and do the right things, and I haven't actually experienced these things for myself. So on October 24th of 2013, I enrolled myself in a care management program with one of our customers. And Avery was my care manager. And it was a beautiful experience. We had 9 weeks of care management interactions. So we started off talking about my HDL and how it was too low, and that led to eating habits, and ultimately ended up with I needed to eat more wheat Chex for breakfast. And it was like I said, it was an experience that I couldn't have replicated, I couldn't have imagined, but it left me with a fundamental problem that, great, we had this beautiful dialogue. We realized that I have poor eating habits and I need to eat better breakfast, and what should I eat, and wheat Chex. But it left me hanging with, well, how do I actually do it? How do I actually get there? How do I achieve this goal and redesign my life? So we started talking about, well, I make my kids breakfast every morning on their way to school. And so maybe the night before when I'm packing the lunches, I can put a baggie of wheat Chex on the counter and grab them on my way out. And that solves part of my problem with not having the time in the morning because I like to sleep. and then we talked about, well, it's good to eat wheat Chex with milk. So I put an empty cup on the counter, I drink my milk, and I grab my wheat Chex, and I don't always put it in the bowl. So that's another topic, though. You know, as we look at healthcare in the U.S., I don't think this is a surprise to anybody in this audience, but specifically in the U.S., we have high costs and low quality with respect to our peers worldwide. But healthcare is definitely an international problem. And we've found that care management works. So when you take somebody who's really sick or really ill, or you apply a high-touch model, that person usually gets better. The problem is, or gets better, or their problems are managed better, I guess, maybe a better way of looking at it. But we know that 2/3 of the people that were identified as catastrophic this year were not identified as such last year. So there's clearly a problem where we're addressing the symptoms but not the root problem. And so this is what gets back to my vision of how do we actually have a care plan for everyone, and not just wait until you're in the sickest, most costliest cohort do we apply these resources to help you. So as we look at what makes us healthy versus what we spend on health, we realize that the social determinants, the behavioral aspects, our environment play a larger role than just simply the medications that we might be prescribed. And so it's a little bit of a change in paradigm, looking at how we focus more on integrated care, the social aspects of care, and not just the clinical aspects. And so as I went through this process, I took a step back and I felt there's a really this paradigm, these competing forces. How do we create scale and take this care management out to more people? How do we enable more people to receive this experience of care management? But the only way that care management is effective is if you get behavior change, if you actually get personalization. So these two competing forces, I won't claim to have solved it by any stretch of the imagination, but I'll walk you through the model that we've used to begin to solve this problem. So looking at how we have care management at the heart and the core of the system, you have to have a data and knowledge driven. It has to have a care plan that can go and can be scaled to every person. As we heard earlier, a team-based approach, and then leveraging automation to do the things and allow for the scale. So let me walk you through the model. So we all have goals. We take actions on a daily basis that affect our body, and there's a feedback loop that sometimes we get and sometimes we don't. You often have healthcare organizations that have programs or things that are guiding their decisions. So these might be financial incentives, these might be payment models, and they do their best to take these payment models of how they actually fund care management and fund the care that they deliver, aligning it with the goals of the individual and collecting data from that individual as best they can. They then provide influences and attempt to change behavior or prompt or nudge that person to do the right things to impact their health. Now the question is, how do we make the system better? So we began to leverage, as the question earlier, machine learning, cognitive systems, to take that and scale it beyond what we're currently able to do today. So with that data, we can identify similar patient similarities, pathways, identify what's working, what's not working, beyond what we're able to do individually. That can then provide a feedback loop back into the system in terms of what programs should be designed to improve health. What interventions can the care manager or the individual that's intervening provide? And how do we go right to the individual, the consumer, and influence their behavior as well? But as we look back and take a step back, it's really three key domains that we look at. One is knowledge. Second one is behavior. And the third is value. So on the knowledge front, how do I make every care manager the best care manager? So how can we take a system and the information and all the daily activities that these individual care managers are doing, and how do we amass their knowledge and share that with more people? So we created a system that allows for experts to take the expert knowledge and design it in the system. And that creates thousands of possible assessments and questionnaires and workflows and care plans and interventions. And then we begin to apply the system to learn what occurs in the system and what are the outcomes of those individuals. And then we can take that and apply similarity analytics. So when I get a new individual coming into the system, then we can see how that new individual maps to existing or similar patients. The second is behavior. So how do I achieve meaningful behavior change at scale? We looked at, we do about almost 3 million automated communication events every month across our customer base. And we began to look at how that changes as we add different modalities, because not everyone wants the same message in the same way at the same time. And we found that as we leverage more and more modalities, so email, text, phone, mobile apps, et cetera, we had a 29% increase in patient engagement and actually achieving the outcomes we were looking for. We also began to leverage the power of mobile. So while mobile isn't the solution to everybody, it's a piece of the ecosystem. It is a powerful behavior change tool because we take it with us everywhere we go. It connects to our devices, and it's an easy way to begin nudging and prompting and integrating new habits into existing behaviors. And we found that this works. So not only are we able to apply this stuff, we're able to measure the outcomes and get real information back from patients and providers. And ultimately, at the end of the day, we are all have bank accounts. We have to fund the individuals working. We have to make sustainable systems. And so as we do all of these different activities within care management, within health, we have to be able to go back and track their value and prove their value. So how do I align the day-to-day activities and making sure that all these activities, these interactions we're doing actually create value in the end? So the system has to be designed from its foundation to capture and measure everything. And so we began to enable organizations to not only manage care management capacity, manage who falls through the cracks in the system, but as they deploy these care management programs, how do they track not only the operational efficiencies that they gain, but in the end, the outcomes that occur. And working with Orlando Health, they're just starting their journey on this pathway, but in the first 2 months after deploying the system, care managers showed up about 3 o'clock in the afternoon to their supervisor saying, okay, what next? And they were able to, within the first 2 months, basically gain 1 FTE within their team and redeploy and do more care management activities. So I appreciate your time, and we'll open up for questions, but I truly believe that with the power of cognitive, with leveraging technology, orchestrated by the human touch, it will be able to make an impact on health. Questions? So we're doing a number of different things. One of the first places we applied Watson was looking at the notes. So we took kind of the same technologies that we use to process large journal articles, and we applied it to the nurse's notes within the system. And we're able to identify key concepts in those notes. So not just clinical values, but things like that the person's a caregiver. And so we were able to take those concepts, those insights, and apply them inside the assessment. So if I'm going to give you a caregiver burden screening assessment, I might want to see all the relevant notes about you being a caregiver or information that might aid that assessment. So that way we can have more meaningful interactions rather than relying on the nurse or whoever to read through thousands of notes. They can see the key concepts, hone in on those concepts that are relevant for the discussion they're about to have with you. Go back. Yeah, so we open up on several different fronts. So we have the core Watson Health platform, and that has a number of open APIs and things that you can leverage to access at the core. And then within our product, we firmly believe that care management is not a monolithic system, that it really is something that needs to be opened up. So we have several different APIs and other things that we allow partners to engage with as well. And then we're creating an ecosystem where we have partnerships with Apple, Medtronic, American Heart Association, others that we're bringing together to share this knowledge and disseminate it across the system. Questions? Yes? Yeah, so to measure behavior change, we're doing a number of things. So I actually went through the FOG behavior change model and course and certified as a Tiny Habits coach in the process. But we are beginning to measure. A lot of it comes with capturing the data. I think as we look at measurement, behavior change data is incredibly hard to measure. And it starts with identifying the patterns that exist, identifying the patterns you're trying to introduce, and then being able to have opportunities to capture that at different moments. And so as we look at that, is begin to leveraging things like the mobile device and other things to have more touch points with the individual, to begin creating a system where you can capture and measure those things. Great, well, I appreciate your time today. Thank you.